We are the Mental Health Association of Maryland. Thank you so much for joining us. This is part of our monthly webinar series presented by the Children's Mental Health Matters campaign. And today I would like to introduce Jen Grinnell. She is with Everymind. So a little bit about our webinar today. So about the session, do you know the warning signs of a mental health crisis? Would you know how to help a friend or family member in a crisis? So with 1 in 5 adults in the US experiencing mental illness each year, it's important to know what signs to look for and how to help in a crisis. This 60-minute training provides an overview of the warning signs that someone may need help, best practices for what to say and do in a crisis, and where to go for help if needed. So a little bit about Jennifer Grinnell. She's a licensed clinical professional counselor who received her graduate degree in mental health counseling from Gallaudet University. She spent many years overseeing mental health clinics, psychiatric rehabilitation programs, and residential programs serving clients with chronic and persistent mental illness. She has been with Everymind for the past 8 years, and she is the director of community mental health education. Jennifer is also a certified health coach and is fluent in American Sign Language. Thank you so much. Welcome, Jen.
Thank you, Jess. Good afternoon, everyone. Thank you so much for being here today. Really looking forward to getting to interact with all of you today and share this presentation with you about how to help when someone is in a mental health crisis, excuse me. We have the chat open, and I know our team is from Mental Health Association of Maryland will help me kind of manage that, and I will tell you why. So let me move forward to my slide. So today I am your presenter. My other presenter, Laura Laskotsky, unfortunately is not as sick today, and so it's just going to be me. So I'll have help managing the chat today. So like Jess said, I work at Everymind. So just a quick snapshot because I want to really get into the meat of this presentation. So Everymind has been serving Montgomery County for over 65 years, and over the last 10 plus years or so really have gone beyond the borders of Montgomery County and serving the state of Maryland and the National Capital Region. We are one of the largest providers of school-based mental health services. We have mental health services that really cross the entire lifespan. One of the things is community education like we're doing today. And we also, my next slide is going to be the first one as we get into it, is Everymind is one of the local call centers that answers 988, which is the suicide and crisis lifeline. We have answered Montgomery County crisis hotline for over 50 years, and we also answer 988. So just a little bit about this as we get started, and it will come up, but 988 is one of the best resources that I love to share when I come and talk about these topics. And we are going to be talking about a lot of sometimes hard information to hear when we think about our youth, mental health, suicide. So you've probably heard this statement before, but I also like to start my presentations this way, is that if there is something that is triggering to you or uncomfortable to hear or hard to hear, please know that there are all of us, myself included, on this call that can support you. If there is something that you need, I know you can chat with the team here. And 988 is another resource. So 988 is 24 hours a day, call, text, and chat. And a lot of times what people think, if they've never heard of 988, we know 911, we call for emergencies, police, EMT. And 988 now is here to provide that same support in a 3-digit phone number for mental health crises. Except the thing about 988 is that 98% of the phone calls and the texts and the chats that come into 988 are where we can share resources. There is supportive listening. A lot of times the community thinks that 988, or if you didn't know 988, that the Suicide Prevention Lifeline was only used if you were actively feeling suicidal, if someone you knew was actively suicidal. But the reality is that most of the calls that we get are for supportive listening, having a bad day, looking for resources. Fewer than 1% of the contacts is, do we actually need to call 911 and get that intervention? So I really encourage everyone who's listening today, whether it's for yourself, if somebody in your, as we go through this presentation and you hear some of the warning signs and maybe comments that someone might make, if you hear those comments that somebody else has made to you, you can use 988 in this way as well. So you can call 988, text or chat and say, hey, someone in my life said something that concerns me, and I'm not really sure what to say to them or what I should do about that. Hotline counselors are trained to answer that as well on 988. So just use that as a resource, and that it's always there. It's free, it's confidential, and anyone can use it. And I really just, I always want to make sure, we always want to make sure that we talk about 988 as such a great resource. So, okay. So let's look at a few things that by the end of our hour today, that you'll be able to take away from today is knowing some of the common mental health concerns, recognizing when someone might be in crisis and what do those warning signs look like, how to listen, and how to listen in the way somebody really wants to be heard. And we'll go more into that. Know what is and is not helpful when someone is in crisis, how to ask that question. Are you having thoughts of suicide? And what does that look like when you ask someone? The other area that we added in is handling crisis situations on social media platforms. And we'll share some real life social media messages that have come up and how you might look at that and what you can do. And then always resources for you, friends, family, anyone. So in the next few slides, I am going to look at some data. We're not going to spend a lot of time on data, but I do want to make sure that I share with you some up-to-date numbers so that we kind of know like what we're looking at. Right now, when we look at mental health and suicide, it is a public health crisis that we are looking at right now. And you might see that this is 2022 and we're midway through 2024. And a lot of the data that is collected from the Centers for Disease Control, the American Foundation for Suicide Prevention, and the Trevor Project, which is where these data points are from, it takes a long time, longer than we would like, for that data to be collected nationally and then really like put back out to the community to use. So this is why it's typically we see it from a few years prior. So in 2022, suicide was responsible for 48,000 deaths, and that's one suicide death every 11 minutes. Suicide is still the second leading cause of death for people ages 10 to 24. And it's a really important data fact, especially as we look at children's mental health matters, and that this is still the second leading cause of death. LGBTQ plus youth are more than 4 times as likely to attempt suicide as their peers. And 54% of Americans have been affected by suicide in some way. The ripple effect of someone dying by suicide and those of us that are impacted is huge. And getting to come and talk to you all today and to be part of Mental Health Association of Maryland's presentations is what we know is that there is still so much stigma that is surrounding mental health and suicide and our youth, and we have to talk about it. The more we talk about it, the more we just lessen and chip away at that stigma to be able to share what's really going on with us. So we have to talk about it more. So I did want to bring to you some like data that was just collected. So this is, so like I mentioned, Every Mind answers 988 texts, calls, and chats. So this data was collected from January 2024 to March 2024, and we have it broken down by age group. So you're going to see the 0 to 12 here on the left, and in the red, if you see this, so this is via texts, calls, and chats of when suicidal ideation was present when someone reached out to us. So if you're looking here, like every single age group, it does get less, but look at our 0 to 12 age group. This is something that is a reality, and we see it every day on 988. 26% of the contacts that were under 12 in this first line, 18, sorry, I got all confused on my data there. Hold on one second. So when you look at that 73% for these top two, these were that suicidal ideation. And one of the, when we look at like service areas and trying to provide services to youth, a lot of it previously was like, oh, high school, which is certainly this 13 to 17 age group. But really what we're seeing is we need to be in middle schools and elementary schools. And there are some there's programming, but it's hard to think about talking to an elementary age child about suicide and about thinking about harming themselves. But the thing is that if they're reaching out on 988 across the country and they're thinking about it also, and we've got to get in there and start finding better ways to get that treatment and that knowledge earlier. So just a little bit about some of that data when we look at 988. So the next thing I want to do is a video. I'm not going to play the full 10 minutes, but this next video was made by a Montgomery County Public School student and about their experience. And I was just mentioning to the MHA MD team before we started about, we just did a focus group last week with some students on this presentation exactly. And so, but I want to share this because it's from a student's perspective. And it is hard to listen to. So just not audio, but just the content. So Audrey and I practiced this, so hopefully it does play with the sound. So I'm going to look to you, Angie and Jess, for a thumbs up that you can hear it.
This is important. You need to listen. Swimming. I'm drowning in a pool of my own madness. Crazy. Insane, and to those who don't know me, they think I am to blame, telling me to think of happy thoughts. And it's not that I'm not trying, it's that I can't control the way it feels. All I know is that it's emotional, and I know that it's real, so I stop. And I wonder how. How did we get to this point right now? Is it because of an unloving mother? No, she loves me. She tells me every day, so then why do I feel this way? Why do the monsters like to dwell in my head, cast shadows when we believe that I'm better off dead? They cause me to think. They cause me agony, and they cause me grief. They cause me to worry. I lie awake and I worry. I sit in my bed and I wait for the sweet release of sleep to save me, but it doesn't come. And when the lights are low, I'm once again left alone, me, myself, and my thoughts. The siren song beckons me into the deep, and I follow, because I am blind and I am lonely. I give in and I drown. I fall into the overwhelming. It fills my heart, my lungs, and my brain. The question remains, and they burn, scarring what holds together my mind and my sanity. I crumble and I think if I was smarter and just a tad bit wittier, if I was smaller and just a tad bit skinnier, then I would be fine. But sadly, life just isn't that kind. I think happiness was not meant to be. Happiness was meant for someone who worked harder than me. And I know that that's something that you might not understand because it's something that you haven't witnessed firsthand, out of sight and out of mind, but it's out of mind all the time. I'm drained of what I once was. This emotional roller coaster is one that I did not line up for, but one that I cannot get off of. I am strapped to these seats to the day that I die, and it's too often too little too late because to you, my drowning looks like swimming.
I thought that there's no way that my family or friends could help me, but I was very wrong. There is always somebody that can help you, and there's so many different options of getting help, but it's really important to go tell somebody that you're feeling like killing yourself and you're feeling such negative thoughts, because from personal experience it was so terrifying, and it was the last thing that I ever wanted to do, but it was the best thing that I've ever done. And the first step is just asking for help, even though it is so difficult to think that there could be something wrong with you that you can't control yourself and you can't help yourself with.
Anything you would say to someone in this position to get them to reach out for help?
It's very, very important that you do, because I thought I was too good for it, or it wasn't that important, or I wasn't that important. If you don't want to reach out to a parent, then I completely understand that, personally speaking, because sometimes you're in a situation where they might not understand, whether it's cultural reasons, tradition, whatever.
Most often people think, if I ask my friend about suicide, I'm going to give them the idea that they should kill themselves. And really that's not the case. What the studies show is that is sort of the invitation for that person to open up about that and to have a place to talk about it and get some support. Because if you're not doing that, that is just staying inside, and it's growing and it's getting heavier, and it's something that people are often ashamed of. It can be kind of like shaking a can of soda and opening it. It can kind of explode everywhere. And so we would want you to reach out, and by naming it and by acknowledging it, that's giving that person an opportunity to open up about how they feel. When you call the number, we'll answer the phone and someone will just say hotline, and they'll say what their name is, and we'll just listen. And we're very patient, so you can call us if you're crying. You can call us if you're having trouble getting words out. We're going to try to understand where you're coming from and try to help you figure out a way to stay safe. Try to figure out ways to cope with heavy feelings. Practice with you how you might talk to your parent or a counselor or even a friend about how you're feeling. You also don't have to call the hotline for yourself. If you're concerned about a friend, a classmate, a family member, someone you work with, maybe they've said something about hurting themselves, or maybe they said something off the cuff like, I'm just really stressed out, I just want to die. And that doesn't really sit right with you, and you think, I don't know if that was just a casual comment. You can call us and we'll talk with you confidentially about that friend. Most of our calls, it's just a call. We're not going to call your parents, we're not going to call your school, we're not even going to call you back unless you give us permission to follow up with you. It's really about helping you and empowering you to feel better and get support. We might encourage you to talk to a parent or a counselor or a teacher about your thoughts, but we're not here to make you do anything that you don't want to do.
I'm just going to move to the next slide so that it doesn't. So I see the question that came up in chat, and I'm going to get that answer for you. So I always like to share that video because it is so, it's directly from the youth themselves. And it is, I like though that we got to the point where they're able to say like, but it's really hard. We know that as adults also, like it's really hard to ask for help. It's really hard to admit that we need help. And so I think the more we can, especially when we think about youth mental health, really listen to the youth directly about what it is that they need, the better we are prepared, like as adults, to support them. So the video goes longer, but just to be here in this space. And so Pamela, I really appreciate this question. And I will send this message to someone on the team. I'll see if I can get this answer for you before our session is over today, because I don't actually know it right off the top of my head. So now let's get into some of the warning signs that you might see in a youth. These can be warning signs in adults also. And please, if you have other questions, feel free to put them in chat as well. So 75% of people are going to give warning signs that something is off, something is not right. But some of the warning signs might look like feelings of intense, ongoing sadness. And let me say this also is, it's going to depend on the relationship you have with the person that you are supporting or wondering about the crisis. So think about that also in terms of we want to know kind of like, is this different from something that we typically know of this person that we're concerned about? So inability to concentrate, loss of interest in activities and friends, a lot of withdrawal and isolating themselves, thoughts of suicide or death. Now, one thing that's important to note is that a lot of people think about dying and they think about suicide, but they might not take it to that next step where they've actually got a plan. And I think this is scary for people to share, to say, you know, I've been thinking about dying, or I'm thinking about this, but they don't necessarily have a plan, because there's a fear that if they even say they've been thinking about it, they're going to be sent to the hospital. They're going to be sent someplace. And so it's important also for us to be comfortable. Well, hold on, let me change that word comfortable. It's not comfortable to have someone say that, but to be okay in that discomfort while someone shares that they're thinking about this. Changes in behavior and their personality. They might have feelings of really a lot of hopelessness, worthlessness, looking at some of this, like engaging in self-destructive or risk-taking behaviors. Some of these warning signs are something just to keep a lookout for, as you might be worried about somebody who might be having a mental health crisis. And I'm coming to look at this question here, distribution of the frequency of calls. Okay, I can get that answer for you as well, Ellen, thank you. So when we look at some of the warning signs, it comes out in a couple different ways. There's physical warning signs, behavioral, emotional. And so we're going to look at a few different things. And again, you'll have access to all these slides and the recording. So you can just kind of sit and listen today, and you can always go back later and reference this as you're looking. And I'll share my contact information, and there's always 988. So some of the physical warning signs that you might see of a pending mental health crisis is changes in weight or appetite. You might see that sleeping, either like insomnia or then awake all the time, fatigue. And I'm not going to read every single one. I'm just picking some of the like excessive crying or crying really easily. And this one is always interesting for me, the crying easily. I'm a crier. I cry if I'm happy. I cry if I'm sad. And it does not matter. I feel it like bubble up in me, and it gets stuck right here in my throat. And so I just want to say, like, for me, I always cry. So this would not be like a physical warning sign probably for me as a crier. So I'm just giving you that reminder, like everybody's different. And so you want to, like, it's just, again, things to think about. The psychosomatic symptoms, this headaches, stomach aches, muscle aches, these physical symptoms that might not have anything, there's no medical something wrong, but it is our mental health. It is this mental health. And for me, like I told you, I'm a crier, but also I feel stress and anxiety in my stomach. So I get really, my stomach, I can just feel it in there when it gets tight. Some people feel it in lots of different places. I've had some clients tell me they feel it in their throat, like this tightening here in their throat, even in the shoulders, or and headaches are a big one. So it's these repeated physical symptoms that you might see. Okay. So some behavioral warning signs that you might see, this is running away. One that if you had any type of, attended any type of training that might have similar content, we hear the kind of saying goodbye, giving away their prized possessions, in an effort to start to kind of wrap up things here before this crisis comes, if they're really thinking about suicide. So like I said, a lot of people think about it, but one of the behavior warning signs is someone sharing this intent or a plan that they've really thought about. That next step is how they might end their life. And so this is a big behavioral warning sign. There is non-suicidal self-injury. If you've heard the term self-harm, where we might be harming ourselves. I saw, for many years, clients that I saw in therapy who we see this non-suicidal self-injury, definitely still a behavioral warning signs, but cutting, and hurting themselves. And a lot of what clients told me is that it was a way for them to relieve the pain, and that this was a way for them to like get that pain out. But it was not with the intent to die. But sometimes, in that non-suicidal self-injury, it can lead to pretty severe consequences. So prior suicide attempts is definitely a behavioral warning sign. And of course, really trying to actively seek that lethal mean to take their own life. Okay. Some additional warning signs, just something to think about. We got, I think I had mentioned we did a focus group with some high school students, and we left, they really liked this, the graphic, and making sure that there was more graphics that they could see and more images. So this was one thing. Here's some other signs when we think about like feeling trapped or in unbearable pain, anxious, agitated, really withdrawing. And we were just really liked kind of this image, that it wasn't all text, that you could just kind of see this quick kind of suicide warning signs here. So, okay. Okay. So, but what is going on when we think about someone who is really in this state of thinking about hurting themselves? What people describe is this like intense emotional pain, and that they really cannot tolerate or endure any more of this pain. And thinking about the video that we saw called Swimming, is that when someone is in that intense emotional pain, and we can all think about that for ourselves, whether or not we've experienced this ourselves, thinking about suicide, or in other aspects of our life where we just feel like, I cannot take this anymore, is that it does not last forever. That pain and that feeling really doesn't last, even though we really think it's going to. And looking at that swimming video is that it's during times like this where we want to reach out. We need to ask for help. And that's like the hardest time to reach out. So when we think about all of our learning as adults in this space and seeing warning signs, we can be that person who reaches out. Even like if the person who's experiencing the pain just doesn't have the capacity, we can do that for them and reach out. A lot of people describe that nobody understands, and it is unique to us, but they're not alone. And people have experienced the same thing and come out the other side okay after reaching out for help. But there is a feeling that nobody understands or even cares very much. There's also very common this perceived burden on others, that their own mental health crises and that it continues to happen is a burden on other people, and that they're tired of asking other people. People talk about like, I can't believe I'm here again, and that I'm sharing this pain again, and that I must be a burden on others. And there is this feeling for someone who is thinking about taking their own life, that there's no way to escape this pain other than by dying. And we know that this is not fact. This is a myth. This is something that our brain lies to us, that there is no way out other than dying. And it's not true, but it's hard to convince your brain of that when you are right in the middle of that. So now we're going to kind of switch. It's not all, there are things that we can do and things that we can say to someone. And so I want to start, I have another video for you, which is the next slide. It's a short one. And this is about active listening. If you remember earlier in a slide, I said one of the things and this is what our hotline does, is we listen, and we listen not to respond, but just to listen. So let's go to this video, and here we go. I'm going to assume that the audio will work once I hit play on this.
So what do we do about all the pain we see in the world? All the pain we feel in our own lives? And why does it seem like our best efforts to help somebody feel better always backfire? I've been studying intense grief and loss, baby death, violent crimes, accidents, suicides, and natural disasters. And I've learned something really interesting. Cheering people up, telling them to be strong and persevere, helping them move on, it doesn't actually work. It's kind of a puzzle. It seems counterintuitive, but the way to help someone feel better is to let them be in pain. This is true for those giant losses and the ordinary, everyday ones. Educator Parker Palmer writes, "The human soul doesn't want to be advised or fixed or saved. It simply wants to be witnessed, exactly as it is." He's talking about acknowledgement here. Acknowledgement is this really amazing multi-tool. It makes things better even when they can't be made right. For example, somebody's struggling. Their baby died, or there's been a bad accident, or their mom got sick, and they're just sad. It's way more helpful to join them in their pain than it is to cheer them up. But here's what we tend to do instead. You have 2 other children, you need to find joy in them. Or, you know what you need? You just need to go out dancing and shake it off. Or, I felt really sad once. Did you try acupuncture? We're not really sure what to do with someone's pain, so we do what we've been taught. We look on the bright side. We try to make people feel better. We give them advice. It's not like this is nefarious. I mean, we try to cheer people up because we think that's our job. We're not supposed to let people stay sad. The problem is, you can't heal somebody's pain by trying to take it away from them. Now, acknowledgement does something different. When a giant hole opens up in someone's life, it's actually much more supportive to acknowledge that hole and let pain exist. It's actually a radical act to let things hurt. It goes against what we've been taught. In order to really support you, I have to acknowledge that things really are as bad as they feel to you. If I try to cheer you up, you end up defending yourself and your feelings. If I give you advice, you feel misunderstood instead of supported. And I don't get what I want either, because I wanted you to feel better. It's pretty rare that you could actually talk somebody out of their pain. Rarely does the admonishment to look on the bright side actually heal things for someone. It just makes them stop telling you about their pain. It's so tempting to try to make things better. When somebody shares something painful, it's much more helpful to say, "I'm sorry that's happening. Do you want to tell me about it?" To be able to say, "This hurts," without being talked out of it, that's what helps. Being heard helps. It seems too simple to be of use, but acknowledgement can be the best medicine we have. It makes things better, even when they can't be made right.
We use that video a lot, and that acknowledgement. I love, love, love this video because it's so hard. As a parent, I'm a parent of a middle schooler. No matter how many times I've watched that video, I get like goosebumps every time because I don't want someone that I love to hurt. And I do want to fix it. But just to be there and to sit with that person is so life-changing. So think about that when we think about like listening actively. And this is how to help anyone, youth, adult, older adult, ourselves, like anything, is first and foremost, like we need to take any warning signs seriously. We can reach out to, again, you'll see like this is like get an adult. So if this was a youth that were, because we give this presentation to youth directly, and looking at like taking any warning signs seriously. When you're listening to someone, you can just reflect back what they're saying, that you've noticed a change in them and that you're concerned. You want to find a safe, comfortable place to talk. So if I'm thinking about when we give this presentation to students, you probably don't want to ask someone how they're doing in the middle of a hallway when you're changing classes. I don't know if any of you on the call have ever been at a school when they change classes in middle school or high school, but it is madness. I have It is so overwhelming. I know it must have been like that when I was in school, but I don't remember it. And being like at my son's middle school when they changed classes, I was like, it's so much. So again, finding that space that's comfortable, offering that opportunity to talk, being non-judgmental. I know I keep mentioning this and I can't wait to incorporate the feedback that we got from this focus group that we did from the high school students. But the number one thing, this theme that was ongoing with these students, was they felt judged when they told adults in their life. They felt judged, and it sounds so simple to be non-judgmental, but it is really hard. But if we can, as adults, actively work on just listening without the judgment, without, it's hard, it takes practice, but that was a big theme with them. Offering hope that there's other alternatives available. We can call 988 together. We can just sit here together. Certainly, though, if someone is in crisis and you're listening and they really have made it clear to you their intent that they are going to take their own life, there are certainly going to be times when you have to call 911. But let's talk about then, depending on the relationship that you have with this person, when you're thinking about asking somebody, and if you can, and you have a relationship with this person and you feel that you can ask somebody, if you can't, you can call 988 and the hotline counselors on 988 can ask the question for you if you cannot. But you can ask someone directly, hey, have you been having any thoughts of suicide or wanting to hurt yourself? If you remember from the video, and it is a myth that if you ask someone, you will somehow put the idea of suicide in their heads. This is the same myth of, we talk to kids about not driving drunk, and we don't put the idea in their head it's a preventative measure. And it's the same concept when we think about mental health and suicide. We talk about having safe sex, using, not drinking and driving, calling, an Uber, all of these things. And so, but we don't yet do it quite as much as we do in these other spaces. But it is okay, let me ask you. You might be like, oh, no, I'm not. But what if you are? Then we've opened up this opportunity to help someone. If they say, you've opened the question, which means you're willing to hear the answer. And now you've just opened up this door to this person to say, I am. And so you can kind of vary the language depending on what that relationship is, with that person. And so if you feel like you can't say, are you going to kill yourself? Can you say, are you thinking about hurting yourself? And if they say yes, you can do a follow-up question, which is have you thought about how you might take your own life? Now they might say oh no, I haven't actually thought about that. I don't have a plan or anything. But if they do, and they say they have a weapon, they have pills, they have something, you can have a message back to them about it makes me really uncomfortable that you already have thought about a plan and that you have the means. And it would make me feel better if you and I could call 988 together. If we can take that next step where you're going to get some intervention in that space, especially if they basically have said, yes, I'm thinking about hurting myself, and yes, I have a plan. You do not need to fix it. It's not our job, your job. It's not your job to fix them or save them. Our job is to stay with them as a community, as that person, and to get them to that next intervention that's needed. 988 can do that with you. And if you really got to that point where you are so uncomfortable and you really feel like you can always also call 911. But 988 can handle all of these calls. They can handle all of this intensity. Not only are they going to help you through with the person you're with, they can also help you manage what that feels like trying to help someone in this space. So I'm watching my time also. So, but I want to make sure I get to some of the things about like, what we don't say and what we do want to say and things that, are helpful. So if you decide you're going to ask somebody and you're going to help somebody in crisis, and then they respond to you, our goal is not to then be like, what? Or act shocked. This is gonna like shut down anybody's willingness to really share any information with you. So don't avoid the discussion, even though it's uncomfortable. No arguing or dismissing their concerns or like, oh, whatever. One thing we always like to tell when we're doing presentations to youth directly is if a friend tells you something else, but they say you have to promise not to tell anybody, we never want to keep a promise like that, because you'll see this statement at the bottom is that your friend might be mad at you, but it is going to be a lot better than a friend who decides to take their own life and you like promised you wouldn't say anything about how sad they were feeling or a plan that they had. We also don't want to, going back to the video of that active listening, is offer this false hope or it'll get better tomorrow, or like they said in the video, like we need to go out dancing. We also don't want to leave the person alone. We want to stay with them. And you don't need to give advice. You don't need to fix it. Just like the video, I know I keep like referencing it, but being there with someone. So a question came up, if it's appropriate, for 988 cards to youth under the age of 18. 100%, 100%. Because if a child of any age, and they're able to text or pick up that phone, if they've reached out in that capacity, I want someone to be there to answer that call, text, or chat 24 hours a day, because the reality is that friends, family, parents, sometimes we really are not open to our child saying some of the things that they're saying. We don't want to believe that our children feel this way or have these thoughts, but there is somebody that will always be there to listen. And I'd rather have 988 available to to any youth of any age that needs that. The majority of our texts and chats that come in from our youth are during the day, while they're at school. And my belief is that thank goodness that we're there to answer those texts, chats, and calls. Thank goodness we're there to help find, and that hotline counselor gets to do what we're doing today and really help that youth that's calling with like problem solving, working it through, giving what are some other options, and being that support like right away. So yes, definitely. Okay, some things you can say. I'm here to listen. But then the important part is the one in parentheses, but then don't talk. Really just let that person talk. I think I mentioned earlier, a lot of times we listen, but the whole time we're listening, we're usually trying to come up with like what we're going to say. And one of the goals here is to just listen without trying to come up with what your response is. You can reflect back what they shared with you, like, that must be really hard. And it sounds like you're really frustrated with this. And just reflecting back what you heard. One of the, the beauty, I always say everyone should have a therapist at some point, get a therapist, is because we need someone to just listen to us. When we're in crisis, yes, but even when we're not, we just want to be heard and have someone feel like they understood what we said. You can say things like, how can we work together to help you be safe? Again, that's letting that person know, like, I'm here with you. We're going to do this together. I'm not leaving you alone. And if you don't remember any of this, anything about what to say or what not to say, you can just, I'm guessing everybody, my phone's like right next to me. You can pick up your phone and text 988. You don't even have to like, you can be like, I gotta figure out what to say because I can't remember any of this. And see what that's like when you reach out to 988, that someone's always there. And there are gonna be people I just showed you the data earlier and the suicide rates. And no matter sometimes what we do, I do think it's important to remember that in the tragic event that somebody takes their own life, it is not your fault. And we can do everything we can, though, by attending trainings like this, learning what to say, learning what to do. But at the end, it really is not your fault. And I think that's also really important. So this is a section we added in here about social media. I'm just watching our time here. So social media is I scroll Instagram and TikTok reels and love them. And but on social media, we are seeing messages from youth, from adults in this social media space. So this is an actual Discord message, if any of you know what Discord is, messages that came in, which is, I just don't understand how other people live day-to-day life. I can barely manage to go 10 minutes without feeling some kind of way, not necessarily about something, but that's the way it is. And so given our time, I just want to make sure this is a platform where we have the opportunity then to respond to somebody on social media. And so remember, if this is given to youth, we usually ask youth, hey, what would you say if someone on your social media platform said this? And a lot of what our youth said, and we wrote them down, was like, hey, are you doing okay? And a lot of the kids said that they would do like a private or a direct message to this person, maybe not right in that same thread. But remembering that it's also happening on social media, and we have an opportunity on social media to also respond in the same ways about like, are you okay? Even offering, I was so happy to hear one of our teams said, like, I might send a direct message, someone said, and say like, hey, have you texted 988? Hey, why don't we call 988 together? We can talk about this. I'm worried about you. And this is somebody reaching out. It might be on social media and through this text, but they're still putting it out there for someone to respond. Okay, here's another one about thinking about actually, getting it done and over with. So again, real messages that are on Discord. So we share these now, we're putting them in, and we're trying to really kind of add more of this context about like, how do you respond then? Because we also talked about like interpreting messages. So one of this other layer of like growing up, not as a youth, but even as adults, is we cannot hear the tone. We can't hear inflection. We have to really, there is so much nuance to reading messages. Or if you think about like, if anybody on the call, if you have kids and they text messages, I feel like it's a whole nother area of parenting as I help manage, like, what did this person mean by this text message? I do the same thing. I'm like, I don't know. Is that like, are they upset? I don't know. Like, I can't really read this. So there is this kind of like other layer of then interpreting that. And what we've been talking about is like still learning how to respond to that. Like, hey, checking in on you. What do you mean by this message? And giving that like reach out of hope, if you will, because they're reaching out in this way also. I do want to look, I don't know if on the call, that you can report something on social media, and the post does get taken down when you report it. But what will happen is, so this is how to report it on Instagram, but what will happen is that the person who posted the message will get a direct message from someone on Instagram saying that someone's concerned about them. And the message will include a suggestion to talk to a friend. It will provide direct access to a local hotline and other tips for getting support. So this is the way to report on Instagram if you didn't know how to do that. And again, you'll get these slides, so you don't need to remember it right now, but it is important that we're teaching ourselves, our youth, that there is ways to report it on social media to help keep people safe. Okay, so the next, I just want to give love giving presentations, and one of the ways that we're able to come and give presentations is we do get funding from Montgomery County. And Montgomery County partnered with multiple nonprofit organizations, including Every Mind, and with Montgomery County Public School high school students, and created a website and a project called Be the One. And it was off of the larger national BeTheOne.org. With the 5 steps of suicide and addiction prevention. And so I always want to make sure I share the slide, because this is where we get some of our funding from to be able to come and do presentations like this. So I think I did pretty good here at 12:22. I don't know if hopefully I left enough time though for some questions. So I think I will stop sharing. Is that okay? And then we can do, okay. Because you guys will get the slides. Okay, hi, there's everybody. Hi. So I'm happy to answer any questions, and Pamela, I did get this answer. Thank you. So I'm going to put in here to the group chat. So Pamela, kind of answering your question that came in originally about like what's the leading cause of suicidal ideation for ages 0 to 12. And there is no particular leading cause, but there is this like mindset, and it does start earlier, this like hopeless, things won't change, but there could be other changes that have happened maybe in a youth's life, whether that's maybe parents got divorced, maybe they're at a new school, like larger maybe issues like that, that our younger group might be reaching out to us about. Thanks for asking. But happy to answer any questions that might come in. Let me take a quick sip of water though. My you might hear my voice. Well, you might not know me, but my voice is a little raspy today. I'm not ill, but my son does swim team over the summer, and I have been yelling way too much in a good way, cheering, not yelling but like cheering. But my voice is paying for it.
Is it okay if I just come off mute and just ask the question?
Absolutely.
Okay, great. And I'm sorry my camera isn't on. I'm actually making peach preserve, so I'm cutting up a bushel of peaches right now. So
That sounds
I'm
magnificent.
I'm multitasking.
I love it.
Thank you. So my question is, I'm a mental health first aider with mental health first aid, and one of the things that I wanted to know is I have a 9-year-old and a 14-year-old, right? And everybody, like Oprah, gives everybody a car. Everyone in my home gets a therapist, right? And one of the things
This is fantastic. I'm going to copy that. I hope that's okay. I love it.
Yeah, take it. And so one of the things that I want to know is, as I look at the mental health needs of both my children, and they are in different stages of their life, you know, I toggle back and forth in how I am supporting them. Like, we just lost my father, so we're dealing with the grief, right? And it comes in waves. So just really wanted to know from a research perspective, because I'm not a mental health specialist. So I do, and I'm very excited to hear that it is becoming a lot more focused to look at the broader group, right? 0 to 18, right? Or from elementary to middle school, to bring that into the fold.
Yeah.
And so what resources and tools are out there? Because the way I am engaging with my 9-year-old is very different than how I'm engaging with my 14-year-old.
Mm-hmm.
But what I'm noticing about the difference is my 9-year-old is a lot more courageous in talking about her feelings.
Mm.
My 14-year-old is more so in this space that, is it cool for me to do that? How will I fit in with my peers? Like, I can talk at home, I can talk with my therapist, but when I get outside of this safe space, then it's not really the cool thing for me to do, right? And so being able to identify the language, because I have to put on a different hat, I have to talk a different language when I'm speaking to both of them. So do you see anytime soon any more material maybe coming out to kind of help, you know, those of us who are in different, you know, segments of life with our children and dealing with youth as a whole?
Yeah. I mean, great question. I love it so much. And I mean, you're right. 9 and 14, you're at different stages. But first, I do have to say that if the 14-year-old, I love that the 9-year-old is so open about it. But if the 14-year-old, maybe, okay, it's not as cool outwardly with their friends in this space of like puberty and being 14. But you mentioned that the 14-year-old did say that they like it's a safe space with their therapist, with you at home. And this is really key is that there is an adult that your 14-year-old and 9-year-old know that they can talk to without judgment, can reach out to. And for me, it's starting earlier and earlier with that, like we get tutors, we go to these things to help us like with reading or math. And in the same way, like I love that you have therapists for your kids, because what it lets them know early on is that this is totally normal. And this is totally normal to have a therapist. You go to the doctor to get like a physical, and we go to the therapist for our mental health. Totally normalizing it. Is there more? So off the top of my head, in terms of curriculum, I know that middle schools, there is a lot of funding that's coming out from the state of Maryland for more services. There's some funding called the Maryland Consortium for Coordinated Supports. It's a really long title, but basically what it is that all 24 counties in Maryland, and I don't know if I'm going to assume you live in Maryland, but all 24 counties in Maryland are getting funding for more mental health supports. I don't know this, but it would not surprise me if we see mental health first aid at some point soon come out with something that's addressing children younger than 12, because there is youth mental health first aid, which is ages 12 to 18, and then of course adult mental health first aid. That there will be another component that is for children that are younger than that. It is the next step in what we need. So I hope that there is, I don't know, there is it's another training that someone can go through, but in terms of actual data, but there are some other trainings that people can go through, but there's just not enough for this under 12 group yet. So, yeah.
Okay, well, I appreciate that. And, I just want to go ahead and give you this one as well. As we're talking about dealing with emotions, one of the things that my youngest just helped me with is as she had a moment of grief, as we call it, riding the wave, when the emotions hit very high. And she's like, I'm on the waves. And I was like, okay, so what do you need me to help you do? And she was just like, let's just talk about it. So we talked about it. And I was just like, well, what should we do next?
Yeah.
And she was just like, okay, well, let's play some music. And I was like, well, let's make a rap song about grief. Not that I can rap, right? And so 5 minutes later, we're making up lyrics about grief and we're dancing. And, so the other piece that I'm recognizing is, like you said, being there, acknowledging that it sucks, right? Like it hurts, it's painful.
Yes.
But you can then begin to identify, what do you want to do to begin to work through this?
Yeah.
Because as a parent, I want to say, okay, well, do this and do that and take the pain away.
Yes.
But I'm learning to take the back seat.
Yeah.
And say, what do you need me to do?
Yeah.
Right?
Because if you give them the opportunity to figure out what works for them, hopefully we remember that, and they remember that the next time we learn that internal way. We always need somebody else to help us, but we don't need to come in and fix it or give the answer. Then we're giving them that opportunity to figure out like what works for them. So
Yeah. Thank you.
Yeah, absolutely.
I just wanted to note we are at time. So I'm going to ask any of you who have questions to hang on to them for a quick minute. Jen, if you are able to stay on with us for a couple of minutes,
I can.
That would be fantastic. And we can answer a couple of questions.
Yeah.
And I'm going to hand it over to my colleague, Angie McRae, to close us out.
Yes, thank you. Thank you all for being here. And Jen, I thank you. This is a can be a very tough topic. So we just appreciate you sharing this with us. So as we wrap up, we want to again thank our speaker today, Jen from Every Mind, and also our children's mental health sponsor, Backpack Healthcare, for making this event possible. Special thank you to all of you for joining us today. You'll receive a follow-up email with a link to the recording of this presentation and a survey asking for your feedback on how we can continually improve these webinars for you. Join us next month for our children's webinar on August 15th, 11:30 to 12:30 p.m., hosted by Pure Play Every Day. We'll be talking about the importance of play in children's lives. If you aren't already, become a champion for our Children's Mental Health Matters campaign. You should be receiving some of that information in your chat right now. So we continue to look forward to working together to support the well-being of families and communities across Maryland. If you have any questions, feel free to reach out to us at info@cmhm.mhamd.org. You can also stay connected with EveryMind by visiting their website at everymind.org or emailing them at info@every-mind.org. So again, thank you. Anyone who wanted to stay on and ask any other questions, we'll be here for a few more minutes. Thank you so much.